Well, the year was 1996. Bill Clinton was president. The Ford Taurus was the most popular car, and the hit song for that year was the Macarena. And believe it or not, only about 20 million adults had access to the internet. And even eBay was just starting its first year. It was a significant year for healthcare as well. If you remember, there was this little thing called HIPAA, the Health Insurance Portability and Accountability Act. We generally today think of it as the privacy rule, when in reality, it was an instrumental process and change for our entire way we conducted healthcare, to include a provision that allowed us to match patients. Matter of fact, it was part of the critical challenge we had in healthcare at that time, which was, as we move more to an electronic environment, how are we going to make sure every patient was identified accurately? Matter of fact, the law even mandated a national unique patient identifier. Unfortunately, in 1999, as we were just getting our feet underneath us from a HIPAA perspective, this portion of it was actually banned. And since then, we have dealt in a world of electronics where we have continued with mismatches, duplicate records, and so many other major issues related to this. This has actually resulted in tragic patient safety issues and a significant burden, both administratively and financially, to our healthcare system and specifically to our CHIME members. Now is the time for us to finally fix this unbelievably difficult situation, but most importantly, solvable situation. We need to implement a national unique patient identifier for this country, for its citizens and its patients. We've come a long way since 1996, and this is the Patient ID Week 2023. We have implemented full electronic medical records, telemedicine, precision medicine, transcatheter aortic valve replacement, TAVR, remote patient monitoring, wearable health and fitness devices. Matter of fact, healthcare technology is integrated in our entire way we live, but yet somehow the very core foundational process of identifying patients correctly wherever they're seeking care is still not been solved. So how is it possible you can lag so far behind in what seems like one of the simplest things to do? We're identified now everywhere. At the airport, when we're getting our driver's license, we are identified correctly in so many other places, including even our grocery stores. So now, after 26 years, we would plead and urge our Congress to set aside not just their political differences, but most importantly, come together in unison for our citizens, for the patients that we are all serving across this great country, to solve this problem once and for all.